Hi, my name is Tyler, and I'm one of 26 million people in the United States that have asthma. Asthma is the most prevalent respiratory disease in humans, and one of the most vulnerable groups that's affected by asthma is children, like John. John finds it difficult to communicate with his doctors. He also finds it difficult to communicate about his asthmatic activity with his parents. And when he speaks to doctors, he struggles to remember his asthmatic episodes in detail. Just the other day, John had to use his nebulizer due to an asthma attack. Is his health really under control? According to the CDC, 1 in 6 children like John visits the emergency department at least once a year, with about 1 in 20 children with asthma being hospitalized. This costs about $5,000 on average for inpatient costs. This is why we developed AiroCare, a smart, standalone device that expands upon the abilities of medical equipment to capture and analyze asthma activity. And during this hackathon, we 3D printed our monitoring sensor enclosure, which helped us unlock a piece of the puzzle to collect meaningful insights. Here you can see a demo of the data that's being collected in real time and analytics that are generated with the prototype. This measures critical airway information that enables us to collect lung performance.
These metrics and signals are then sent to our high-fidelity Figma prototype, which shares these statistics and metrics with a patient so that they don't have to remember or recall their asthmatic experiences anymore. A physician can also access the patient's data through their physician's portal, thus removing the need for a patient to have to communicate their experiences with them. Here, a physician can see exactly how long they used the nebulizer for, as well as total lung capacity, average breath minute, peak respiratory flow. All of these metrics and more are crucial for a respiratory therapist or an allergist to make important clinical decisions for the treatment of their patient, along with insights and a patient chat to gain more context about the patient's condition. AiroCare helps drive better quality care to asthmatic patients. There are a few other companies in the asthmatic landscape. There are Philips, which creates state-of-the-art nebulizers as well as inhalers. Propeller is an acquired startup which tracks inhaler use but not nebulizers. And there's BruteCare, which has engineered a customizable nebulizer. However, they are not automatically personalized but manually customized. We understand that there are 160,000 respiratory therapists, allergists, and pulmonologists in this country. With 160,000 physicians, we understand that it would cost approximately $100,000 to integrate our patient portal to each of these practices. With a CAGR of 25%, we estimate that a market size of 1.7 billion within the next 10 years. So right now we have a standalone device to collect data from patients' nebulizers as they use it, as well as a tool to communicate doctors. And in the future, we're looking to target a wider inhalation market and redirect R&D efforts for inhalers, provided long-term data collection. And together we're AiroCare.
Thanks.